Welcome to the Voodoo Power Podcast. Welcome to Plates and Pancakes. We're sitting down today with Dr. Michael Hartle. Dr. Hartle is not only a chiropractor at Allen County Family and Sports Chiropractic, he is a board-certified clinical nutritionist, a certified chiropractic sports physician, an active release technique provider, a certified strength and conditioning specialist. He is a certified Strongfirst instructor and co-developer of Strongfirst barbell certifications. Along with finishing his doctorate in exercise science, he is a former nationally ranked powerlifter and a semi-pro defensive tackle. So, welcome to the show, Doc.
Well, thank you for having me. I'm blessed to be here with you.
So, the one thing I found when I researched you is you're definitely not scared of school.
No, I'm not.
Now, you didn't start out, I guess, in the chiropractic area. You started out maybe in electrical engineering. Is that what I heard you talk about?
University of Minnesota. Yep.
So where'd the switch come in?
Well, I injured my back when I was at a gym training for powerlifting. That's what I did for 20 years before I played football. And I hurt my back, and I went to an orthopedic surgeon. He wanted to remove the disc between L3 and L4, which is about your belly button level, and fuse the vertebrae back in 1986. Well, I didn't want to do that, but that's the only course of action I had. Friend of mine recommended me go see a doctor of chiropractic, which I didn't know what one was. So I went and saw him. He said he could fix me, canceled the surgery. A year after starting treatment with this doctor of chiropractic, I was able to compete in my first powerlifting competition with no pain and restored function and everything with that. So then I started thinking maybe after I got done electrical engineering, get my master's in biomedical engineering. But then I took another step forward and said, why don't I just become a doctor? And so I looked at the University of Minnesota Medical School, but then also found that there was a chiropractic school in Bloomington, Minnesota, which is a suburb of Minneapolis. And so I looked at that, so I decided to go the chiropractic route, and that's where I went to there for school, went to Northwestern, and graduated in November of 93.
And then you've just kind of been adding on to your certifications since then, huh?
Yeah. And then, I've always wanted to do a PhD, but it's always kind of been way in the background. My youngest son is 21. He lives with me, but he'll be moving out here in July. He's moving to Columbus, Ohio to work with Chase Bank. He just graduated from Indiana Tech, which is a university here in town. And I thought, you know what? I should do that. And so I went online, I did some Google searching, and Ball State University is just south of me, about an hour and a half, which they're well known for their exercise science department. So I called them. I said, do you guys have any online options? Because I wanted to still be able to practice in my office here full time. And they said, no, you have to be down here 2 or 3 days a week. Well, that kind of shut that one down. Well, then I started looking, and there's at that time, about 10 universities in the country that offer an online exercise science PhD. And so I looked at there's one in Chicago called Concordia University of Chicago. They're a Division II NCAA school. They have 5,000 students there, so that's quite a bit. And they have a huge online. They started their online PhD program in 2017, so way before the pandemic. And so they had it, by the time the pandemic came around, they had it well greased and well oiled and everything with that. So I went ahead and applied. And even though I don't have a master's, they allowed me to use my experience and everything else I have with my DC to apply, and they allowed me to come in. And so I'm in my 10th class right now.
So how long do you have before you finish that up?
There's, I think, 19 total classes, so I'm over halfway done. Then I have the dissertation after that. So I'm probably going to graduate sometime in or get the PhD sometime mid 2025. Of course, depends on how long a dissertation takes. And, some people, they pass their comps, which is the final test you have before you become a candidate. And some people just sit on their laurels. Me, I just want to get the darn thing done and move on. So it was kind of cute. One of my patients says, well, when you get your PhD, what do we call you? And I said, I'm sorry. He says, well, you're already a doctor. Do we call you doctor? Do we call you doctor squared? You have emphasizing the math aspect, so I thought that was funny.
Yeah, I get what they're saying. I mean, how many doctors can you have before you have to change it?
Exactly. Well, isn't Bruce Banner, the Hulk, doesn't he have like 7 PhDs or something like that as far as his character in the movie?
That sounds about right, yeah.
Yeah, I just one PhD, it's a lot of work to get this PhD and work full-time and do everything else on the side. I can imagine getting 6 more after that. I'm like, no, I'm done.
It seems like a lot of work, especially when you have the full life you have with a full practice, a gym in the back. I was actually going to start asking some questions about that. So you kind of have like a one-stop shop there. from your Instagram and all that. You added a gym in the back, got your practice.
Yep.
How do you keep all of that in balance?
Well, number one, in the clinic, I have a great staff. We have 5 other people that work here with me. Holly, who's my clinic manager, has been with me since 2018. She's and she says that she's my right-hand person. She does everything here. She's great. We got Michaela, we got Katie, we got Joshua, myself. So there's 5 of us total here. We are looking for an associate doctor to come on board to help handle some of the load. But there's a lot of stuff I do. I teach certifications for Strongfirst. So like in 2 weeks, I'll be down in Tampa, Florida, teaching a barbell certification. So just, I love my electronic calendar on my phone. I shouldn't say electronic, I should say my calendar on my phone for kids nowadays, but you know what I'm talking about. That thing keeps me grounded because I know exactly where I need to be. My girlfriend, Amy, she sometimes goes, well, when are you going to be able to spend time with me? And I said, well, okay, I got this hour. So, I mean, she's also a busy person too. So we work it out, but it works good.
Now, talking about Strongfirst and traveling around the country, how did you get hooked up with that and the kettlebells and then actually moving it into barbell?
Well, it was interesting because in 2000, Pavel, who started Strongfirst, he actually was part of a group called RKC back in the early 2000s. And he had written some articles in an old magazine called Powerlifting USA. And it's no longer around anymore. The gentleman, I think, had retired or passed away, the publisher. But Powerlifting USA, so Pavel wrote some articles for it. And in those articles, I was kind of intrigued by what he wrote, but I really wasn't, whatever. I got my own powerlifting thing going on. And kettlebells and barbells are, a kettlebell is a cannonball with a handle on it. And barbell, of course, you all know what barbells are. And in 2004, I drove from Indiana up to Minneapolis. The NSCA National Conference was up there. Dragon Door, which is a company he worked with, was up there and had a booth, and Pavel was there. And so he invited me to come to one of his kettlebell certifications in St. Paul, Minnesota. And at that time, and I said, no, but thank you. I bought a couple kettlebells. Well, those kettlebells came back to my gym, and they gathered dust. They're basically a big 53-pound paperweight, so to speak. And I stopped powerlifting in 2005, decided to do kettlebells. And so I went to, in April 2006, went to St. Paul, became certified. It was interesting because my best barbell squat is 705. And, doing a double kettlebell front squat with double 24s is only 106 pounds. So it was different because I'm like, well, I've done 7, this is no problem. But the way we do it in the technique aspect, so Pavel kind of intrigued me with his wanting to have safe technique. And so I started teaching with that, became a team leader, then a senior instructor. And then he called me one day and said, hey, Doc, I'm starting this organization. We're going to do Strongfirst. I want to put on a barbell certification. Will you write a manual with me? And I said, sure. So we spent about 6 months going back and forth writing this manual. And then I've been going around the world, been to Italy and been to France and England, been to South Africa, Australia, teaching the barbell certifications. So it's one, and now I teach kettlebell certifications as well, too. So there are definitely 2 parts of the strength realm that can be intertwined, and you can use them together. And I have, I do that all the time. So I teach students how do you combine kettlebells and barbells. So we do that all the time.
That's what I was going to ask. If you would have started the kettlebell sooner in your career, do you think it would have helped some of your numbers?
Oh, definitely. It would have helped my deadlift. I like to tell students I'm deadlift challenged. Whereas if you're familiar with powerlifting, right? Okay. So you have, you got your subtotal, your best squat, your best bench. So I was always, one of my friends called me a subtotal god because I was always way up there. Bench big, squat big. Deadlift, I hung on for dear life. I was like hanging on by my fingernails because, guys would jump from first attempt to second attempt, 100 pounds. I'd go 30 pounds, and then I'd go maybe another 30 pounds. So I definitely would have helped out my deadlift. One thing I noticed as I was training for football, I was still doing, barbell and kettlebell together, was doing heavy double kettlebell swings, enhanced my lockout at the top for the deadlift. Because I was like, I think one day I had like 485 or 495 on the bar, and I was doing some triples with it. And it's the lockout was always my difficult part. And I locked it out, and I checked the weight. I'm like, holy shit, that was easy. And I have to allude that to the fact, obviously I didn't do a scientific research and all that stuff, but allude to the fact of doing heavy double kettlebell swings by snapping my hips to the top, getting that lockout very strongly, using heavy kettlebell weight, enhance that. I know Donnie Thompson, who's a former powerlifter, he has said the same thing too. So a number of powerlifters have said that. My best deadlift was 635, I think, 635. So, I mean, it was up there, but it wasn't great. But I have a long torso. So when I deadlift, that bar is at my crotch.
Mm-hmm.
Remember Lamar Gant? He was literally just above his kneecaps when he locked that bar out. So I was only halfway done by that point.
Right. You had to keep going.
I had to keep going and lock out. I'm standing at a hip hinge at that point. They don't allow that in powerlifting. So,
well, that's what I was going to ask. So you're talking about kettlebell swings. Do you think it sped your hips up, made them stronger, and you had a quicker snap into the bar so that your hips were taking the load faster?
Right. So even though, for example, so if I did double 48 kilos, which is 212 pounds, okay, and yes, that's 212 pounds going forward. My best stuff is 635. I said I did at 495 for a triple. That's way above that. But again, I'm not the speed of my hips, as far as locking out my hips, was not as fast as doing the kettlebell snap. But by using lesser weight and a higher speed, my rate of force development was much faster with that. So it's just interesting to be able to do that. So I recommend people, if they want to help their barbell deadlift, either do some heavy two-hand swings where your two hands are this far apart, or do double kettlebell swings, and it definitely will help out as far as with that. One of the things in the kettlebell world that will help with your powerlifting.
And then you could just incorporate that on a speed day, like say you were doing speed squats.
Yeah.
Then you could take maybe the barbell out of your hands for a little bit.
Right.
Put kettlebells in it.
Right. Yeah. When I was training for football, I didn't have a speed day, but I did those after I did my deadlifts.
Mm-hmm.
So I wasn't exhausted afterwards, and so I did them after my deadlifts. You can do them before your deadlifts if you want to, but then especially if you're going heavy, you're going to be taken away possibly from your strength aspect with your heavy deadlifts.
I'm kind of jumping around on the questions here, but being we're already down this road, let's just keep going.
Sure.
So you were a power lifter, USPA. Is that what association?
USAPL powerlifting. Yep.
Okay. So your best squat was a 705. You said that. You had a monster bench at 535.
Mm-hmm.
And then your deadlift at 635 with an 1840 total.
Yes, sir.
So we'll go into the bench press because you managed to move into coaching for the USAPL.
Mm-hmm.
And you helped them achieve some pretty good success.
Yes.
Did you guys win a world title?
2004, we had the World Championships in Cleveland, Ohio. And so we won a world title. The women's team won the world title. I think the men placed either second or third that year.
So some of them guys are some big bench pressers. How did you move into the coaching role?
Well, I stopped powerlifting in 2005. I started coaching in 1998. So I moved into it because I think the head coach at the time asked if I had come on as an assistant. And then after that, he said, can you take over because I can't do it next year? So I started coaching in 98. So I've been through, went to New Zealand. That was freaking awesome. We made a family vacation out of it too. So we brought the whole family down there, and then we went there in Hawaii afterwards. So that was cool. But it was awesome coaching the men and women. Yes, we're only doing one lift, the bench press. So you have to use a lot of strategy. Whereas when you go to the powerlifting world championships, you got 9 lifts. So you have to, obviously you want your best squat, your best bench, but then you got to do your deadlift and use that as that. So you're almost like coaching the deadlift part of a powerlifting meet is very similar to coaching the bench press part because you only got 3 lifts. Mm-hmm. Unfortunately, there were some people that, when you coach them, for example, we had one guy, I think we were in Slovakia, and he had actually the world's best bench press in his weight class for that year. But he ended up placing 4th. And one of the reasons was because after his second attempt, he had missed his opener, got his second, so that now he's got a bench on the board. I said, hey, we can get you in the silver position. And he goes, no, I want to go for the gold. I said, if you go in the gold and miss it, you're going to be in 4th. If you get it, great team points, but we can get more secure team points by going to silver and walk away with the second place. Well, he wanted to go for even more than he had done previously. And at that point, I said, okay, just choose what you want to choose. And I kind of wiped my hands of that, even though I was coaching him, and he missed it. He barely got it off his chest. And so he came over to me later on and he had his head down and he apologized to me. But again, it was just one of those things where sometimes your ego, especially at world championships, gets in the way. It's like I always tell people, Usain Bolt, when he wins the Olympics, his goal is to get the gold medal. If he runs a 10.2, obviously he didn't run a 10.2, but if he ran a 10.2 and won the gold medal, he got a gold medal. Not very many people remember what he did to get that. Mm. It's like when Chiefs lose on Sunday, for example. I'm joking. Let's see if we get a rise out of you there. you're going to remember that they're the Super Bowl champions in 2023.
Mhm.
You know, they're not going to remember how many yards Mahomes threw, how many sacks a defensive tackle got. You know, they will remember that individually, but we don't remember that kind of stuff.
Right.
So, but I
No.
very much enjoyed coaching the bench team. It was a lot of fun.
So you guys, it was a raw bench press.
No, actually, we used shirts at that time.
Okay, single ply, multi ply,
Single ply, yeah.
single ply. So it wouldn't be crazy different. It is different than a raw. I don't want to make it sound like that, but it's not crazy different. The single ply is not adding huge weight to your bench press.
No.
And you could train raw, I suppose, and then just have your shirt ready, and then I guess as you're prepping up for your competition, start moving into the shirt. Is that how you guys do it, or do you always train in a shirt?
What I usually tell people is that when I competed in powerlifting, I would not put on any gear until the 3 workouts before. So the first, second, third workout before the meet, I'd put on gear and I would slowly phase those in. So I built myself up as strong as possible raw, and then I would add in like an old squat suit but straps down and some beat up knee wraps for the first session. The next session, having some newer knee wraps, have my squat suit I'm going to wear but straps down again, and then straps up for the third workout. And then my knee wraps very tight, so I want to be as close to meet conditions as possible. But like I also told people, I never ever maxed out in the gym ever. My lowest I'd go, like for example, when I squatted 705, I did a 655 double in the gym squat, and that was the highest I went before I did that 705. So it's about 50 pounds less with that because my goal was to max at the meet, not in the gym.
Okay, so when you're setting yourself up to get your numbers all set up, how do you do that when you're not really sure what your max is? You got a pretty good idea, but you're not really sure. How do you decide what your opener is going to be?
So in that regard, my opener at that meet was 650, and then my goal was to go 705 on my second, and because I had squatted 700, I think 2 months before, so I knew that was good. And my goal third was going to be 722 or 727. Well, unfortunately, we had a very, 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 very strict judging crew, and I'm always a deep squatter. But I got 2 reds on my opener, and I went, damn. So I did what I always coach people to do: retake your opener again. So I retook it and I smoked it, and then I went to 705, which is a new PR by 5 pounds, and I got it. And it was just, it wasn't hard, it wasn't easy, but it was somewhere in the middle. It would have been a good second attempt. But, it is what it is.
Yeah, it would have had you on track for where you wanted to end up.
Yeah, right. But I didn't want to jump to, say, 722 or 727 and miss it and then be stuck with 650.
Yeah, it would have knocked you down quite a bit from where you wanted to be.
Right.
So kind of moving back into the bench pressers a little bit, just because of your coaching experience, what creates a good bench press?
First off, you need to have your setup. The setup is huge. One of the things that when we created the manual for Strongfirst, a lot of the bench press part of the manual is what I used as far as my setup. I always tell people that, before you squat or deadlift, you always set your feet first. So feet are the very first thing you set before you even try to pull it off the floor or squat down. You got to have your feet rooted to the ground. So same thing with the bench, we get our feet set first. And then we go ahead and lay back on the bench, and then we get our scapula, shoulder blades set properly. So I like to retract and depress the scapula as much as possible. I want as much of an arch through the thoracic spine. And you're going to have some mild lumbar hyperextension, but it's a mild. Unfortunately, nowadays you see people who literally have almost 80, 90 degree lumbar curve, and they get up from the bench and like, oh, my back is killing me. But they didn't actually do anything with their back at that time, but they held it in a isometric contraction at that point. And then I'd like to touch somewhere between my nipple line and the top of my xiphoid process, which is the bottom of your sternum. And I like to touch, not necessarily, I'm not touching my abs, I'm still touching my chest, but low on the chest there. I know there's what's his name? Dr. Tom McLaughlin, I think. He's a former powerlifter, bench presser. He did some research, and he had figured out that the optimal bench press technique was curving butt back over that. But my thought process, and I know Pavel's thought process, is that, and Louis Simmons says this too, his shortest distance is a straight line. And so we try to bench straight up. Mine is a slight angulation there. But if you have great thoracic mobility, be able to extend the thoracic spine, you're able to get more of an arch through there. And then when you do that, you not only save the AC joint, but you also save the glenohumeral joint here as well too. And the arms are more about a 45, the humerus about a 45, and then that, if your arms are out here, you're not benching properly. So that's that. Obviously, if you have a shorter upper arm versus a longer upper arm, it doesn't take as long to finish their lift. But I have seen someone's like my friend Brad Gillingham. When he bench presses, it looks like he's doing a close grip. But he can bench. He used to bench over 600 pounds multiple times. And so he's a big dude. But again, it's just one of those things. And strong bench is also up here too. And if I had the ability to go back to the kettlebells to use the kettlebell swing for my deadlift, I think my deadlift probably would have been at least maybe closer to 700.
Mm-hmm.
But that is what it is.
You're working with a lot of them guys. They kind of have their own program in mind. You're trying to coach them. How does that work out? Where's the middle ground on what your ideas of how they should be training and their ideas of how they should be training? Where do you guys meet?
Well, so it's interesting. So when you look at the Olympic programs, you have, training programs where you are almost, I don't know if you're required, but you have to do, or that's, so a lot of the coaches are heavily involved. The coaches at the Olympic and World Championship level are heavily involved with the athletes. With USA Powerlifting back when I was doing, I'm not sure if it's different now. I haven't been involved with USA Powerlifting for a number of years, but when that, we were not necessarily involved with that. I would have them send me their last few workouts before they got to the meet, and so I can see where they're at, what their possible goals are, and everything. But I would have a conversation with them before we get there and say, "This is what we're going to do," and all that stuff. And then they would go ahead and get it done. And I will be honest with you, coaching women is much easier than coaching men, because women are very strong individually, just like men are, but they're much easier coachable. They listen to more, almost to reason better. Men almost put on their blinders and they say, "Oh, I got to do this. I got to do this." But if you're in Europe, you're, especially from the East Coast, you're 6 hours ahead of the East Coast. If you live in California, you're 9 hours ahead. So I think that gentleman I talked about in Slovakia, I think he was from California. So I said, "When's the last time you benched heavy at 3:00 in the morning?" Because that's what it was back in California when he was doing it there. And he goes, "Well, that's a good point." Now, if he comes over to Slovakia 3 weeks ahead of time and does some workouts, hey, he's begging to be better off. Mm-hmm. But most people don't have the financial resources to just take 3 weeks vacation and do that kind of thing.
So you have some guys running periodization, you have some guys running conjugate, you have some guys doing a mix, and then you're just taking their numbers of their last workout and trying to put them in a situation that'll get them the best numbers.
Right. And I asked him, I said, "Well, I want you to put together what your opener, your second, and your third attempt are. And then I want you, once you get your opener, give me, what your optimal, second attempt is, what your goal for the second attempt is, if you say max goal, and then what your minimum for that is, and then same thing for the third." But once I see them do their first attempt, I almost know exactly what I'm going to choose for their second and their third. Because obviously, and you've competed in powerlifting, you said, right?
Yes.
So when you do your opener, sometimes it's still sluggish. You're not quite there yet. And also you do your second, and it goes much smoother than your first. You have that happen. Sometimes your opener, you smoke it, and your second, you get crushed by it. You're like, what the hell just happened? Then all of a sudden you do the same attempt for your third, and you crush it. So, there's a lot of mental aspect. There's a lot of physical aspect going on there. So you can't always, but again, when you get to that world level, these are the best of the best. And so they don't generally have those type of, irregularities there. It's almost like the NFL with the my Minnesota Vikings. They're down 33-0 at halftime, and then they end up winning the game 39-36. I mean, how does that happen? It's like, does some high school team come out and play the first half, and the Vikings came back for the second half? Same thing, too, with powerlifting. So you don't see that up and down thing too much. But again, when you see the opener, you're like, okay, I watch. So again, I watch them warm-ups. I help them warm up. So it's not as involved as, say, the Olympic programs, as skiing, and as far as, tennis and all that stuff with that. It's more as far as looking at the time when they're there.
You were heavily involved with this, and then all of a sudden you decided, hey, I think I'd like to play semi-pro football. How does that decision get made?
Well, I was age 38. I think I had reached kind of my limitations as far as what I wanted to do with powerlifting. I knew I could have probably done more weights and stuff, but at that point, I had one of my patients who played for a team not too far from Fort Wayne, and he was a semi-pro gentleman. He's a running back, and he was like his mid-30s. And I thought, you know what? I'm 38. I'm very strong. I can go ahead and do this. Let me try it. So I played for a team called Lima Warriors, Lima, Ohio, which is about 75 miles east of here. And so we had practice Tuesday and Thursdays, drove there twice a week after I got done with the clinic here, and had games on Saturdays. And, my first year went okay. It was interesting because for 20 years of powerlifting, my feet didn't move. The rest of my body moved, but my feet did not move. And so the defensive coach goes, man, you hit that dude with like a ton of bricks, and then you stop. And I'm like, well, it makes sense because my nervous system is not used to moving my legs too much during that. Well, at the same time, I was coaching. I used to be the head track and field coach at my kids' junior high school, and I used to coach football too. So then I started, okay, listen, I'm gonna do myself what I teach my kids to do on the track. So I went to the track and I started training and all that stuff, getting running. I used to be a sprinter in high school. So I used the grass drills over here at my clinic and do the track over there, do lifting. And so that next year I was able to start moving my feet better. So I decided, okay, the first year went well. I came out, no injuries. I'm still alive. I can do this again. So the second year I started playing for a team called Adams County Patriots, which is in a town called Decatur, Indiana, which is about a half hour south of here. And so we started playing. Our team did really well. Matter of fact, we went down to Florida in the beginning of 2008 and played the national championship, won national championship for AA semi-pro. So that was pretty darn cool. We were undefeated for 2 years straight. We were kicking everyone's butt. And then some guys got some injuries and guys left the team. And then, I moved to a team called Miami County Blitz, which is a town about an hour west of here. And I finished my career with them. So they're a good team too. We didn't do as well as the Adams County Patriots, but we had a lot of fun. We were kicking everyone's butt. It was really cool.
So what carryovers did you see from your powerlifting career to football? I mean, how could you incorporate some of the stuff that you'd been doing for a long time, take that to the football field and be successful?
Well, it's a good question because when I got done powerlifting, I was training absolute strength. How much could I do for one rep? That's it. In football, I had to play outside in the summertime, 95-degree heat with full football gear on for 3+ hours and survive. So I had to change my absolute strength and change it to strength endurance. So I still did deadlifts. I still did bench. I still did, squats. I did front squats. I did Zercher squats. I did, close grip, all these different things in powerlifting. But then I incorporate a lot of kettlebell use too. So kettlebells is more, you can develop absolute strength kettlebells, but it's more almost about strength and conditioning, more about strength endurance. So I started doing that. I was doing lots of sprinting, lots of running outside. So I incorporated that. But again, the carryover, it gave me a lot of strength. So I've been blessed. I'll knock on wood here. I never had a knee injury. A lot of guys, I had several 300-pound guys roll into the side of my knees, in the what do you call it, the scrum of the football defense and the offense there. They just bounced off my knees. And I think because of all the powerlifting, it made my tendons very strong, my ligaments very strong because I had to withstand that force while I was squatting or deadlifting. And so I was blessed about that. I did have one bad ankle sprain, but I came out of it pretty fast. But other than that, no injuries during football. And I think part of that was because I started football in a very strong state. So I recommend the football players, you need to not just play the game, but you also need to do training around year round. Doing other sports, for example, if you're in high school, if you're a multi-sport athlete, it makes you a better athlete because you're not having these overuse injuries that you get if you're playing baseball 365 days a year or basketball. We have that a lot in Indiana. A lot of people play basketball year round. But then they end up having, shin splints, they end up having Achilles tendonitis, plantar fasciitis, all these, even lower back pain from doing that same sport all the time. So again, back to the powerlifting and football, they very much have a marriage there. God rest his soul, but Mike Webster, former center for the Pittsburgh Steelers during their time when they won their 4 Super Bowls. The guy could bench 500 pounds, and he was an All-Pro center. And unfortunately, he passed away due to some head injuries and some issues with the head during football. But still, he was a very strong man.
You get that going. You get away from football, but you're still training for football. You're just looking, well, any sport, basketball, whatever it is.
Right.
You can keep the weights, keep the running, keep everything involved, but just try to open yourself up to get away from sport-specific movements, maybe, to kind of keep your body healthy.
Right. For example, I got some rugby patients here. I play with the Fort Wayne Rugby Club, and I had a talk with one of their best players. He was a patient of mine, and he said he enjoys coming in and getting treated because he says he no longer has hamstring issues. He always used to strain his right hamstring during the football season or during the rugby season. And so he's been able to do that. But I also told him, I said, okay, now we need to get you strong. And so it was interesting. We were having a discussion regarding utilizing the trap bar, the dreaded trap bar. Yes, I saw the eye roll. I have the same eye roll too. And I say, well, trap bars are good for farmers' carries. And that's about it. Now, if I had Grandma Jones come in and she wanted to deadlift with a trap bar, and I would tell her, no, deadlift with a barbell. And she goes, I don't want to do that. So in that case, I would say, okay, if it's a difference between no training or training, go ahead and use a trap bar. But in that regard, when you look at the joint angles, the ankle, knee, and hip, when they're doing it, it's more of a half squat versus a half deadlift. Because the bar is not, the center of the bar is in the center of your body versus being in front of your legs. So this gentleman, I told him about barbell deadlifts, and I said how it enhances your posterior chain very strongly, much better than the trap bar deadlifts do. Obviously, you still use your anterior chain when you're like this quads and your abs when you're doing barbell deadlifts. So he came back and he goes, man, I got a new PR. So I'm thinking maybe like, high 3s, high 4 or low 4s. He goes, yeah, I just pulled 530. I'm like, what? I said, damn. He goes, I've never pulled that before. Thanks for your suggestion. So it was just, but I said, now be careful now. Don't freak yourself out because you're still training for the off-season rugby. But I also told him, I said, get your butt outside and do some sprints, or go inside on a turf field and do some sprints. Because if you're not doing that and you build all this strength, you're not going to be able to move when the season starts. So you need to have that concurrent aspect growing at the same time, work on your sprinting aspect, at the same time developing your strength aspect.
That's what I'm getting into more the more guys I talk to. It's funny you brought it up because I've been talking to some really good high school coaches lately, and that's kind of what they say is we do great at testing the barbell lifts and tracking and keeping track to make sure we're getting stronger. But through the course of the year, we're not tracking sprints. We're not we're not actively going out there and treating them like a max. So then when the season starts, you actually suffer because you just took it for granted that you were faster, but you didn't work them into your workouts.
Right. And that's the one thing. So I told this gentleman, I said, I don't need you to go out there and do, 100% intensity on your sprints. This is the off season, but I still want you to go out there and maybe hit 75, 80% of your intensity on your sprints. Maybe every so often throw in a really fast flying 20. Where your flying 20 is where you start before the 20, you start at 20, you're at full speed at the 20. So that kind of stuff. But again, don't do that, but still get some sprinting ability, have the leg turnover, have your foot contact with the ground. Because we want to be able to, when season starts, that you can be strong and fast at the same time.
All right. So moving into keeping the body in the shape you need for your sport.
Right.
You work on ART. You're also a chiropractor. How often, especially in the real physical sports like football, how often should an athlete be getting in for ART or chiropractic work?
If I had, let's say, a optimal patient, I would say during football season, if you're not suffering from an injury at this point, but just that once a week. And just so I don't do ART by itself. I do chiropractic and active release technique together. We always do them together. I've had patients call and want ART separately, and I said, no. When you come in here, we're a chiropractic clinic. ART is complementary to the adjustment, but we want to do both together because both things together, the sum of the parts is greater than individual parts themselves. So I would say once a week if there are no injuries. Now, if they have an injury, we may see you twice a week. But you have enough contact force during that football game, as I'm sure you're well aware of. that your body kind of goes through some things. You may be a sub threshold where, say, this is your pain level, and say you have an injury, but it's more like here's like a dull ache. Here's where you have sharp pain where you can't move the joint very well. So I would say once a week. I'd say off season, maybe every other week, depending. Or say the season ends and you got some injuries that kind of built up through the season, which a lot of football players have, even rugby players, that maybe spend, the first 4 or 5 weeks after the season's over, maybe come in twice a week so we can get some good treatment in you to help these injuries heal and get you restored, to go from dysfunction to function and get you back functioning. Then after that, we'll go every other week, train hard, train heavy, train fast. And then when we get to the near season, go back to once a week.
My introduction to ART was through work. They started bringing somebody in once a month. They kind of, talk to the employees, see what they can do to help. But somebody that doesn't understand what that is, how would you explain active release technique to somebody?
So a lot of people are familiar with Graston or tool assisted as far as working on a system like that. ART is where my thumbs are doing it. So in a sense, what I'm doing there is I'm breaking up some scar tissue adhesions, things that are in that joint complex that are not moving properly. And so it's a form of myofascial release. We're breaking up myofascial releasing the scar tissue, whether it be ligaments, tendons, muscles. Even sometimes you might even have some nerves, have a peripheral nerve entrapment, be trapped next to a muscle where it's supposed to naturally glide. It's not gliding properly, so we're able to do that. Dr. Mike Leahy, who started ART many years ago, we started going to him, and maybe before we had running water, 1995. But we started doing that, and it's just been amazing. It's an amazing technique there. I have my hands with me everywhere I go, so I can do it on anyone, anytime. Graston, you have to have tools, which tools are okay. But the thing about tools I don't necessarily like is that when my thumb is on your muscle or your tendon or your nerve or whatever else, I can feel what's going on underneath there. With a tool, I can't do that. And so I can feel it even as I'm doing the ART, as you're moving your leg or moving your arm, I can feel what's happening. Whereas a tool, again, you can't do it. Tools are good. They call it like scraping, I guess what they call it. They still can be functional, but I think using my hands is much more than as far as using a tool.
Yeah, you can feel when the muscle releases.
And then even if it doesn't release, you can feel it start to change. So it may take multiple treatments to be able to do that.
All right. Now, you had mentioned Donnie Thompson earlier.
Yes.
In the podcast. I was watching something with Dave Hoff the other day, and he said his career would have been over had he not went to Donnie Thompson and had some ART work done. Now, I mean, Dave Hoff went on to achieve the biggest numbers of anybody ever. So there must be something to the work and the technique.
Yeah, Donnie was, I know Pavel, he's a gentleman who started Strongfirst. He did a lot of work as far as with Donnie and helped him out and designed his pro. I think Donnie put on, I think he was already pulling like high sevens in the deadlift. Now, granted, he's like me. He's got a long torso, so he's got a long way to go with that thing, the deadlift. But I think he put on 50, 60 pounds in his deadlift just from incorporating kettlebells to his program. It's interesting going through my PhD program. It's more of an anecdotal evidence. So it's more of a kind of a case study that he added kettlebells, he increased his deadlift, and then you have athlete Joe X over here who used kettlebells, did not increase it. Well, maybe he had other things going on in his life. So it's not exactly a randomized, double-blind controlled study, but still, it still helps with that. And I noticed, like I said, my ability that when I locked out my deadlifts, I'm like, hey, this is more crisp. It's more fluid with that. So,
and when you take somebody like Donnie, his body awareness is so high. His programming is so good. Yes, it's anecdotal, and I see why you couldn't do it with Joe over here and get the same results, but he hadn't competed and trained himself the way Donnie did. So I'm sure that goes into it. Now, I guess going further down this little rabbit hole, is there any common injuries you see in athletes, especially maybe at high school, college level, that seems to carry over? Backside injuries, knee injuries. Is there something that you see that everyone has and could be avoided through other means of rehabilitation?
So, for example, as a defensive tackle, nose tackle, one of the things I always say is that I got double teamed a lot. I was one of the bigger guys in the field, both height-wise and weight-wise. So I got double teamed a lot. So I always used to say that every game I've had 600 pounds of man meat coming toward me, 300-pound guys trying to stop me. My goal was either to stand my ground or split the double team and get in the backfield. Their goal is to move me way the hell out. With that being said, my arms and hands are doing this type of thing. So my shoulders took a beating. And one of the things I did in the kettlebell world that actually helped with that was, the barbell world is having a strong bench press enhanced that very strongly. So having that my bench press was 535, I was able to move, guys around with that, but also doing the kettlebell get up. The get up is probably one of the best exercises that I've ever done. It literally, I think, saved my shoulders for 10 years. So I started playing football at 38, stopped at 48. I was older than most referees out there. One referee goes, "How do you move your knees?" So I showed him, and I go, "I move my knees like you move your knees." Well, my knees are like shot. I don't even play football. So you keep yourself healthy, you'll be able to use your joints. But the get ups, I would, one football game I had, I strained my shoulder, and then that was Saturday night, and I did the get ups, and there's another move we do called a kettlebell arm bar, which is more of a mobility move for your shoulder and your thoracic spine. And those two things, by the next Saturday, my shoulder didn't even hurt anymore. And so I did the get up, I got adjusted, got massage, all these recovery things there. So you could say my recovery game from week to week was strong. So I did a lot of things to enhance my body so I could be playing the next week. But it also enhanced my ability to be a doctor of chiropractic, to be a father, to do all that stuff. That I wasn't one of those people that say, son, I can't play with you today because my shoulder's shot. Kind of thing. So
it kind of works into an ounce of prevention is worth a pound of cure.
Yeah, very much so.
All right, now we're getting ready to move into track. We're getting ready to move into baseball. I have both of those athletes come out to the gym and work. Baseball seems like as their arms are getting in shape, a lot of elbow issues. It seems to show up in the back and the shoulder area. You can see them knotted up. I have no idea what I'm doing, but I know that seems to correlate. What can baseball players, let's start there, what can baseball players be doing to relieve some elbow pain?
Well, the elbows are very similar to the knee joint in the sense that a non-traumatic knee injury is generally due to either a hip pelvis problem or an ankle problem or both together, and they're meeting in the middle. When I see these non-traumatic like ACL injuries, that tells me that their hip and pelvis area is probably weak. Or they didn't train it properly. So because when you run and move, your hip joint puts your feet where they're supposed to be. Same thing with the arm. So when I move my arm, my shoulder starts to motion. Okay, the elbow kind of goes along for the ride. So most elbow issues are due to either shoulder, thoracic, or neck issues, and or wrist issues, or both. So my goal is to say, okay, so that's why as a doctor of chiropractic, I'm looking at everything. So someone comes in with a bad elbow. So we had one guy, he came in with really bad tennis elbow. He was a welder, so a lot of using his hands. So when I called in the state of Indiana, when you do workers' compensation, you only can treat the area of pain. Well, I called the insurance adjuster and I said, here's my thing. He's got this, but he's also got shoulder issues, which are not necessarily from work. He's got some neck and upper back areas. Can you give me permission to treat that? And then she said, yes, we'll do that for a short period of time. So we treated all that. This went away. And so when you see kids with elbow problems, I would work on their thoracic and cervical mobility. Okay, get some motion in there, mainly the thoracic spine, because the scapula floats on the thoracic spine. If it's not floating properly, then that means this joint, and then obviously their joint down here is not going to be moving properly. So make sure the thoracic spine and cervical spine are moving properly. The shoulder blade have good full range of motion with that. And then also the wrist thing. You get those things taken care of, generally most elbow issues will almost self-resolve.
So the elbow is just part of the chain.
It's part of the chain, right. And so when you see like Tommy John surgery, it's a surgery that some people need to have. But I would, and I'm not a physical therapist, I do physical therapy in my office, but one of my physical therapists I'd worked with before, he's got, as far as Tommy John, he actually has a tattoo of baseball laces where he had his surgery. That's kind of cool. But again, I would be interested to do like some kind of a study that you would have people who did not get Tommy John, but you made sure that their thoracic cervical mobility were good, even their lumbar mobility was good, that their scapula moved, and that their wrist and shoulder moved properly. And would that heal the injury from Tommy John? I don't know the answer to that, but again, you would not do that with a baseball pitcher that makes $20 million a year, because you need him the next year. So you don't have time for a study. You got to do the surgery, have him recover, and then move on. But I'd be curious to see what would happen regarding the two aspects there. Does that help you out with your players we were talking about?
Yes, it does. It would add in some recovery aspects that we're probably not utilizing enough.
So when you tend to focus with narrow, blinders on, you need to kind of widen that out there, because again, the nerves to the arm come from the neck. Your scapula is attached to your collarbone, to your AC joint, to your glenohumeral joint. I mean, all these different things are attached there. So you have to kind of go up the chain and figure out what's going on there.
Would the same principle apply to hip flexors?
Oh yeah, most definitely.
That's probably the next most common injury we get, or that we see. I almost think maybe it's overuse, too much front side training and not enough backside. But I don't know enough on that, so that's why I wanted to talk to you. How would you go about having a kid ready, knowing the season's coming and the brutal work is ahead of him? How do you have him prepared, or she prepared, to handle that?
Handle
what's coming. So let's say the hip flexors, they're going to get beat up.
Yeah.
How do you train the rest of the body to be prepared for that?
Well, so when you look at the body, obviously we have opposing muscle. We have agonist and antagonistic muscles. So when you look at, for example, most people who get tennis elbow, we talked about that earlier, what happens is that the wrist flexors, doing this, are usually super tight. That changes the force on the elbow, which makes these extensors weak. So a lot of people go to the pain area. We treat the pain area, but we also got to treat this area as well, too. So regarding hip flexors, you got to make sure your hip extensors, gluteus maximus, as far as the hamstrings, are very, very strong, because they oppose the hip flexors. So when you watch the running motion and you go through stance phase and swing phase, you can see the different motions of the body, how it works there. So, for example, once the foot hits the ground, that's the hip extensors and the knee flexors that are working hard to be able to move the leg. But then when they bring the leg up and drive it in like a high knee drill, so to speak, they're using their hip flexors to get that leg in front of them to go down the ground. For example, Usain Bolt, I always remember this, his stride length at full speed was 9 feet. Now, he was like 6'4". So he was unusual for a top-level sprinter to be that tall and that skinny. Most people are like, built like this, and they're 5'10", 5'8", and they're fast sprinters. But 9 feet. So, but that means when he was going through swing phase, his top front leg was hip flexing very strongly to get that leg out, and then he would actually propel it behind him.
So his off season would be GHRs, reverse hypers, deadlifts, anything he could do to get the backside where it could match the strain of the front side.
Well, yes, and I also would do not just bilateral, like say glute ham raise, GHR, but I also would do single leg too, because you need to do, like, for example, single leg deadlift. Okay, there's this. So when you're doing that, you're actually using one leg, so you're getting both a neurological proprioceptive aspect from balancing on one foot, but you're also getting that hip. So you're going into a hip hinge with the leg that's on the ground. Meanwhile, the other leg is going up. So you're actually literally just taking the whole body and rotating on that hip joint. And when you're doing single leg and double leg, so like back squats, double leg, glute ham raise, double leg, deadlifts, double leg, but then you also need to do single leg stuff too as well. And you can do either, for example, using kettlebells or dumbbells. You either have a dumbbell in one hand, dumbbell in both hands. I recommend, if you have kids do that, get used to doing no weight at first, body weight only. And then they can do that. So I would do both single and double leg.
That makes so much sense that it's crazy. I guess, we do single leg work, but when you put it in the terms that you just put it in,
right,
it totally changed the way I viewed it right then.
Right.
I mean, that couldn't make any more sense.
Well, it's just funny because I made the single leg comment to a friend, and he said, well, if I'm foot's on the ground, it's one thing, but if I step on top of an Airex pad, it's going to be a whole different world. To me, if you're training for a sport, a contact sport like rugby, football, hockey, whatever else type thing, standing on top of an RX pad with your strength aspect is almost like doing squats on top of a Swiss ball or an exercise ball. It just, to me, it just doesn't make sense. If you're trying to show your balance, great, no problem. It's almost like a circus trick. Let's go have a beer now, kind of thing. But if you're doing it as far as for strength training, do it bare feet or minimal shoes or something like that, so your feet can feel the contact of the ground. So it's interesting. When I was powerlifting, I had a 1 or 3/4 inch heel underneath each heel, and I actually had squat shoes made by Scott Safe. He used to make Safe squat shoes. He's not around. The company's not around anymore. But when I started playing football, because I was going to be in football cleats, I didn't train in football cleats, but I trained in a 0 heel rise. So I trained in not in the minimum shoe. I think they're Adidas Samba shoes. So they're like indoor soccer shoes. Some guy goes, "Do you play soccer? Do I look like I play soccer?" No, I played. But I was training in those shoes because I'm training in a flat shoe with my football cleats. So I wanted to train there. So same thing here with kids as well too. Another thing too, if you have kids that train in runners or like running shoes or whatever, get them out of them. Throw those things away. I'd rather have them train barefoot in the gym than train in those shoes that are designed for walking. Or get, like I said, a pair of Adidas Samba shoes or whatever else, which are not minimalist shoes, but they're good, sturdy, low heel, no heel rise shoe there.
We're big fans of West Side here at the gym. So you open up their lockers and almost all of them have Chucks sitting in there.
Perfect. That's good. Those are the same exact aspect there. So, but again, but I would recommend doing single and double leg. I was actually interested. I was reading an article about a NFL running back who always got these little weird injuries every year, about the third or fourth game of the season. Then he went to a different strength coach, and I think he was like the third leading rusher that next couple of years. And he said the one thing his coach trained was he started doing single leg work. And I went, that is really good, because when you're running at for half a second, both feet are off the ground, but normally only one foot's on the ground, if ever at all. And I'm thinking, that's fantastic. So you have to build up the strength with double leg stuff like a back squat or front squat, but you also need to do single leg stuff because every athlete in the field is running. So maybe your track guys, your baseball guys, yes, there may be baseball, you're standing there in an athletic stance for a period of time, but then all of a sudden you have to basically go from 0 to 100 like that. So you have to have the ability to be able to not only have lateral agility, because all of a sudden you're facing here, I got to run this way real quick, but you also got to have the ability to run on one leg.
We add one leg stuff in, but I'm going to have to reevaluate how much and what it is we're doing to get the most carryover to the field.
Right. Exactly.
Now, it seems like new information is coming out all the time. I don't know what's accurate and what's not. So while we have you on here, we'll just ask you. Say a kid gets injured in competition. Mm-hmm. Sprained ankle, don't really know what's going on, but they're experiencing pain. Get them off. They're done for the night. What should they be doing? Should it be the immediate ice that we've always been told? Should it be heat? Should it be, it seems like every study you read says something different. Where are we heading with a kid that's hurt until we can get into somebody like you and get it taken care of?
So, yes, there's been some research in the last 3 or 4 or 5 years about, don't use ice. It's not as good as they say because it, decreases the blood flow. You want the blood flow going to the injury because the blood flow actually has nutrients and things like that to help the inflammation. I'm a big fan of ice. I'm from Minnesota, so we love ice anyways, sit on it, fish on it. We drink beers on it, no problem with that kind of stuff. But still, I'm a big fan of ice. And so what I'll tell this patient when it comes to a severe injury, I don't care what age they are, I want you to put some ice on in 15, 20 minutes. Well, I don't like ice. It doesn't feel comfortable. Well, become comfortable with the uncomfortable. You have an injury. We have to do something different than what you've done before. So we got to put some ice on it. And here's why, because most people, when they put heat on, they just let the heating pad sit on there for an hour. And what heat does, it increases blood flow to an area. But with it increasing, it generally increases the chemicals that influence inflammation that are pro-inflammatory, which then makes the swelling even worse. And some studies have shown that the pain that you have when you have a sprained joint is due to the skin expanding, being stretched out. Because normally, say your ankle's this big, it's now this big. Okay, maybe you have a thankle or a cankle, whatever term you want to use, that kind of stuff. If I were to choose, I'd rather have someone do nothing then use heat. If they have ice available, put ice on it. You definitely want to elevate it. If you can put some compression on it, whether you put like a neoprene sleeve on it, maybe wrap some ace bandage, be better wrapping around it, decrease the swelling on that. If they can walk on it, that'd be better for them to walk on it. What I tell my patients when they sprain their ankles, that I say, I want you to take shorter strides. Don't try to take your normal length stride because you don't have the stability to do that. So just walk, have your feet, instead of your feet, say 3 feet apart in a normal walk, have them 2 feet apart. I'd rather have you walk as normal as possible with a shorter stride, because by doing that, you allow scar tissue, in this case, a good thing, to actually start forming the bonds back together. So if you have someone, I would probably use ice. If they don't want to use ice, just don't use heat. Heat increases inflammation, so you can let the inflammation take its course naturally. But I would always put ice on it. I think the research is good research, but I found personally that ice has helped me a million times better than ever heat ever did.
One or the other doesn't matter to me, I guess. It doesn't matter. I just want to see what is the most efficient way to help somebody at that point.
Right.
So we can move into another one of your fields of expertise, nutrition.
Yes.
I would say the majority of high school athletes are in a deficit daily on calories.
Mm-hmm.
How do we manage that to get more food in them where they're performing at the highest level possible?
Well, obviously, for example, most kids don't eat enough protein. I think the research is out there showing that you need about 0.7 to 1 gram per pound of body weight. I think the average person gets 0.5 grams per kilogram of body weight, which is, a factor of 2.2 with that. So first off, can their family afford it? I don't know their family dynamics. Are they able to afford it? You want to have, if you can have more protein, have quality protein. Don't eat foods that are high in, saturated fat, high in sodium, all that kind of stuff. You want to have, meat products, whether it be chicken, fish, meat, all that stuff. Those are things that would definitely help them. They want to make sure their fatty acids, which they get from eating fat, is also good too. But you want to have good quality fat. So polyunsaturated, monounsaturated are much better for you than, say, saturated fats. So cooking with olive oil versus sunflower oil, much better for you. I had a patient, actually wasn't a patient. I was on an advisory board for the Catholic Youth Organization, the organization that ran the Catholic sports things in Fort Wayne for a number of years. And a guy, he was saying, man, my knees are just killing me. This guy's like his mid-50s at the time, and he couldn't afford to come in. So I said, all right, here's what I want you to do. I want you to take 2 tablespoons of olive oil every day and put them in a spoon and throw it down. Don't cook with it. Don't, if you want to put it in a salad, go ahead and do it, but make sure you consume all 2 tablespoons. 6 months later, he came back. My knee pain is much better, because what it does is it adds anti-inflammatory as far as substances in there. Plus, it also helps lubricate a joint. So, if you got a rusty hinge, you put some oil on it, you move the hinge, now it moves better, kind of thing. So that's all he did, and it actually helped his knee joints. Now, granted, it's a case study, so it's just, it is anecdotal, but that's where you need to increase their fatty acids or their fat. There's supplements out there we have one here called EPA DHA, which is the good parts of essential fatty acids that actually come from fish, like salmon and herring and sardines and stuff like that actually help as far as benefit their bodies in that regard. But again, obviously their family, but if they have, let's say, unlimited resources about that, increase their protein, increase the good fats in their diet. Those are probably the 2 best things they can do with that. And if they're an endurance athlete, like cross country or track, long distance, they want to increase their carbohydrates as well too. It's interesting. So when I was actually training for football, I'm more of my blood type is O negative. So I generally do much better with meat and veggies. If I eat a lot of carbs, I get bloated. I get, some swelling and everything. So I wasn't eating a lot of carbs. And there was one practice where I usually trained in the mornings on Tuesdays and Thursdays. And then I treated patients, and I went to football practice after. And I literally hit the wall. I used to race 10 speeds back in high school, and I know what hitting the wall is on a bike, but I never knew what hitting the walls. I just literally almost just could not move. And so I started adding a cup of rice to my diet twice a week. and just adding those little bit of carbs enhanced my ability to be able to train. But I was actually doing more aerobic training and a little bit of anaerobic training with that as well too. And so I discovered that I need to increase my carbohydrate intake during football season because I was doing a lot of running. When I got done with football season, I went back to my, you call it a paleo. It's not, I wouldn't call it a keto diet, more of a paleo type diet. I would do that. But then I get to closer to football season when I was sprinting, I'd add more carbohydrates because I was burning those energies. I was burning the energy up there. So again, that's another thing you can do as well too.
Now you kind of hit on that a little bit. You know, everything I know, I've just kind of studied out myself. There's nothing backing me,
Right.
other than some study. But the question that comes up a lot with athletes, especially this fall, is I have a lot of kids that come out here that are wrestlers and football players. So they want to be ready for football, but then midway through football season, their mind's starting to switch to their weight and what they need to do to be ready for wrestling. So without sending them down some rabbit hole of really worrying about cutting weight, I always thought maybe carb cycling, like you just kind of mentioned, might be the answer. You
Right.
know, that way you're ramping your glycogen up so many days a week, but then you're bringing it down to help you lose
Right.
weight. I don't know, what are your thoughts on something like that?
So we have the same thing here in Indiana. We have, wrestling season. If you have a football team that goes the distance, they play Thanksgiving weekend for the state championships. And wrestling actually starts sometime in October or whatever. And so you get kids who, in the high school my kids went to is very good in high school football. So there's a number of kids that would show up to the wrestling season somewhat late. But my thought process goes, keep the goal the goal. Your job is to perform on that football field. That's your sport right now. If you're good enough, you can go to the wrestling and go wrestling after that. But the wrestling coach has to understand you may be 15 pounds above your weight class. And so at that point, you need to maybe start losing some weight or go to a higher weight class. But obviously, we don't want to lose weight where you're doing it improperly.
Maybe moving forward, that will be where we go, is like, hey, this is the goal today. We'll
Right.
worry about the next goal when we get there. I know qualifications have affected that, where in the past it never was, but you got to qualify for your weight way ahead of time. So that's probably what has them thinking about that.
Okay. What I would do if I were to do anything nutritionally, what I would do is I would say, okay, we're in the 8th game of the season and you start thinking about wrestling, you're a little heavy, but we don't want you to lose strength because you still got to perform four quarters of football in the field. So I would maybe start decreasing their carbs, not get rid of them entirely, but then have them, each person would be individual, and just say to his parents or even him too that, okay, when you get to that point where you feel like now it's affecting your performance, go back just above it. So let's say you're taking a cup of rice a day. Let's say you go down to a quarter cup a day. Well, that's too little. You start feeling sluggish. You're not recovering fast enough. Go back to half and stay there, because then you will lose some weight with that aspect. I mean, I will tell you that during football season, I usually lost on average from 10 pounds from the beginning of season to the end of season. But I maintained my strength, and that was not me really changing my diet. That was just from all the running, from all the football stuff, sweating my butt off outside in 95-degree heat. And then I would obviously, and even in each game, I would lose almost 5 pounds of weight just because of water weight.
All right, so let's take that into my next question. I kind of had sitting here off to the side. Cramps. Are cramps nutrition related, or are they overstressed related? So when you see a kid cramping up on a Friday night, where do you start looking for the cause of that?
I would probably go more nutrition aspect. And yes, you can actually have neurological aspect where you just say you've overused their system and their body is just shutting down, but that generally doesn't happen too often. Like I said, I hit the wall. I did not really shut down neurologically when I said I hit the wall, but I did actually, my brain just couldn't move anymore, that kind of thing. So that wasn't that, but cramping usually, their electrolytes are low on electrolytes. They're not drinking enough water. So my goal before every game was I wanted to drink as I'm driving to the game. I usually peed right before I put on my football pants. And then it was interesting because during the game, I had 2 water bottles. That one was first half, one was second half. And my son's always made fun of me, but what I put in there is I'd put 6 ounces of Red Bull, which I don't like energy drinks per se, but I did that in there for the caffeine, but it also has taurine in it. It's if you want to use a safe energy drink, that's probably the safest one to use because all the chemicals that are in most energy drinks. I put water in there. I put some branched chain amino acids. I put some additional taurine in there. And then I put this thing called Endura, which is made by a company called Metagenics. It's a electrolyte replacer. So I'd shake it up, and it looked like almost like I was drinking urine. That's the color of it, but it was not drinking urine. It'd be like, are you drinking urine? No, I'm not. I'm drinking, So I'd drink one first half, and I probably almost get finished with one in the second half. And I'd walk down with the game, and I didn't have to pee. And I'm like, what the hell? But obviously, I was drinking also plain water throughout the game. So I was literally like a internal water faucet. I was putting so much water in, but I didn't have to pee because I was actually sweating it right out. But I never cramped in any football game ever. And so I gave this solution to some of my teammates who did cramp, and they actually noticed that they did not cramp either as much or at all during the game.
All right, so let me ask you. I watch a lot of Justin Harris stuff. That's where I try to. I mean, he seems to have some great information. So, what are your thoughts on like a high molecular carbohydrate, like a waxy maize mix, where your body's taking that in super fast and pulling the water in with it? Would that be something that you could utilize on the football field?
Yeah. What I would do is, and I told my teammates, I said, don't just do it the first time at a game. Do it, 2 or 3 weeks before. Try it in practice. See how you would do with it, how your body tolerates it, because everyone's GI tract is different from the next person. So I'm a big believer in testing things in the off season, or in maybe in the start when 2-day practices go, start using that kind of stuff. Because then when in game time, okay, well, I did 3 ounces here. I felt kind of crappy, so I'm only going to do 2 ounces. I felt better with 2 ounces. Let's do 2 ounces, or just as a hypothetical. But you want to basically do that. So, yeah, it's very similar with that. So this Endura stuff, it has some carbohydrates in there, obviously. It's not a protein drink. It's a powder that I would put in there. I'd shake it up, and it worked like it should. It worked like it should. So, again, I've never heard of we said Wazy or Maize?
Waxy maize. So,
Waxy maize?
So it'd be a high molecular carbohydrate. I know there's some other ones out there, but that's just the one that he always talks about, that he always used.
Well, the reason I like the Endura stuff is there's not of extra chemicals in there. Like you need to have a chemistry PhD to be able to read some of the chemicals that are in our foods nowadays. So there's not a lot of extra additives that are not good for the body. And that's why I like to use an Endura. But again, this stuff sounds like it's pretty good. So
what I noticed about it was, I don't know, I might be using too much logic with it, but when you start talking waxy maize, I start thinking corn, and the texture of it is cornstarch. I mean, that's essentially what it looks like to me, is cornstarch. Okay. Right. And then it makes a slurry very similar to cornstarch, and you got to almost put a little something in there to make it taste good. But the thought process, I guess, is once you start cramping, you're kind of done. Now, is that accurate? There's really, I mean, you can drink pickle juice, you can drink mustard, you can do whatever you want. But once you start, let's say second quarter, you start cramping, is there anything you can do to come out of that by the end of the game?
Well, yeah, you can drink as much water as possible, but also you want to have some kind of electrolytes aspect, especially if it's more nutritionally based, as fast as possible. It may take you even a full quarter before that even happens.
That would be my next question, is you're fighting a time game.
Right.
How quick can your body produce that? So let's say if it's water, your body can't start doing anything with it until it's the temperature of your body.
Right.
So if you're drinking cold water, your body has to warm that up before it can even start. So now you're fighting time. Does that sound accurate?
Generally, yeah. I mean, I'm not a big fan of drinking, room temperature water versus cold. I love cold water. I love my cold water. I drink it all the time. I haven't had any issues with it, but once it gets inside your body, 98.6, it warms up pretty damn fast.
Okay. And that makes sense. That was, it sounds like a dumb question now that I look back at it, but I actually am kind of glad I asked it, because you hear that all the time at work. When you're working out and it's really hot, they're like, hey, drink warm water. Your body can start using it quicker.
I'm gonna say maybe a slight BS to that, but I drink cold water all the time, and I've never had an issue. Now, I've never played around with warm water, so I don't know. Maybe I would actually see a small percentage of training improvement with that. I don't know.
Okay. At the end of the day, it's just how do we decrease the time from when the cramping starts to health?
Could be something you could probably try, use cold water versus warm water and see how it does with that. But I would have to probably assess that you're probably not going to see much time difference there whatsoever.
You think the electrolyte in water will bounce them back pretty quick if you're getting it in there at the onset of it?
One of the things we use, so to kind of take what you said and to do a little bit of a tangent, I have patients who have restless leg syndrome, who have things like that, cramping. one of the supplements that I give them is I give them something called calcium lactate. It's made by a company called Standard Process, and almost every single one of them notes that there is some improvement or a total gone decrease as far as their symptoms, which is amazing. So in that case, it's more of a calcium deficiency, if you want to use the term deficiency, than it is anything else with that. So they don't need to be on this medications and all that stuff, and they get off these medications. That the calcium lactate takes care of it.
We'll move into just a little bit of different area before we wrap up. So your practice is on Instagram. You post a lot of pictures and stuff like that on there.
Yep. Chiro Power.
That's what I was going to have you say, Chiro Power on Instagram, and then you kind of keep up with the things that are going on at your practice.
Yep. I'm actually finishing up writing a book about kettlebells, and Human Kinetics Publisher is going to be the publishing agent with that. So it'll be sometime hopefully coming out near the end of this year. So I wrote a lot of things in there. So a lot of things I've shared with you are things that are in that book. So if people would be kind and purchase the book, I'd be honored. So.
Well, that'd be a pretty good book to have. So when that comes out at the end of the year, are you going to post that up on your Instagram? How are you going to publicize that so I can find it?
I'm just going to walk around with it on my forehead so I can, advertise it. So yes, it'll be posted everywhere.
Good deal. So when that comes out, I'll be looking forward to it.
Cool. Thank you. I think it's called titles Kettlebell Strength Anatomy or Kettlebell Anatomy, something like that. So I'm a big anatomical guy. I got A's in anatomy when I was in chiropractic school, so I love anatomical things. So,
all right, man. Well, I'm excited to pick that up when it comes out. That's not an area we've moved into much, but I see where it's an area that we should be looking into a little bit more.
Yeah, most definitely. It's something I think that would be beneficial to. So there's a gentleman, one of our former master instructors with Strongfirst. He actually. I remember him saying that he coached a football team, I think it was in Oklahoma or something, and the two main moves he did with his players was swings and get-ups, all kettlebell. Kettlebell swings, kettlebell get-ups. And those two things he always started the freshmen on, and he generally would slowly start moving into some barbell stuff with the upperclassmen, but sometimes kids just did kettlebells, and they were just as strong on the field as everyone else.
Your risk is very low and your reward's very high on kettlebells.
Good. Yep, your ROI is very high.
Yeah, and especially when you're starting to deal with young athletes that don't have much experience in the weight room, you can maximize a lot more training, I guess, with them.
I agree.
So I think Indiana's lucky to have you.
Well, thank you. I appreciate that.
If somebody's in the area or around, needs some treatment, how would they be able to get a hold of you and maybe get in and see you and have you do a little work on them?
Well, my clinic is called Allen County Family and Sports Chiropractic. At the intersection of Illinois Road and Jefferson Boulevard. They can also go to my website, Chiro Power, CHIROPOWER.com. They can also call me at 260-969-0109. That's my clinic. I'm also on Instagram. I have my personal page, my Chiro Power. I got a third page, Advanced Strength and Speed Strategies, which I'm doing a lot of posting on that lately. I'm on Twitter. I'm on Facebook. So all that stuff. We have areas to go ahead and get a hold of me there.
I know you got a warm day ahead of you in Indiana, so maybe you get a little bit of work done and get out and enjoy it.
That's right. Cool. I'm looking forward to it.
I'm just talking to you a little bit. I mean, you're a wealth of knowledge, and I appreciate you coming on the show. I know you're a busy guy, so for you to open up some time to come on here definitely means a lot to me. So thank you very much.
All right. Thank you.